Good morning. I'd like to start this off by offering everyone a nice good morning and thank you for attending here on the first of our 3 Recovery is Happening webinars. Obviously, my head is surrounded here by a list of our sponsors who have generously donated to help support CoveCare and their efforts to get the word out to the community. To offer a quick tease, you know that we will be offering everyone a list of 10 ways to combat stress, and thanks to one of our sponsors, we can get a little view of one way that a lot of us relax and deal with stress in our home. So I'm just going to pull up a quick video here from one of our sponsors. Excellent. So anyone like me who has pets at home and who welcomes the respite from the real world that you get when you're surrounded by an animal or a loved pet, because we're very thankful for our friends at South Carolina Medical Hospital when our pets aren't feeling well. Thank you very much for sharing that, and again, thank you to all the rest of our sponsors. Thanks to all of our attendees here this morning. Our first foray as CoveCare Center into the world of providing webinars to the community. And thanks to and that's my dog barking, so this is the reality of working from home these days, right? And thanks, of course, to our participants, our panelist participants this morning for here and offering some information to the community, which is really the reason why we're here today. All that's been going on in the world and the closure of many businesses, CoveCare has been here offering services, adding wellness and recovery to the communities of Putnam and beyond throughout this pandemic and this difficult time that we've been having. And part of the purpose of this webinar is to make sure that people in the community understand that we're here, that we're still offering our services, we're still available to support children and families of our community. And we are focusing this morning on children and families. We're here, we've been operating, things are different, but CoveCare remains an important support to the community and the people who we serve. And that's why we're aptly titled here, Recovery is Happening, and it hasn't stopped happening. So the first thing we're going to do is hear from each of our panelists this morning. So I'm going to ask each panelist to introduce yourself, let us know how long you've been with the agency, talk about the populations that you serve in your program, how people are eligible, and basically what you provide. So we'll start with Christina McGuigan.
Good morning, everyone. Thank you. Oh, can you hear me? There we go. Sorry about that. Good morning, everyone. Thank you, Eric. So my name is Christina McGuigan. I am the Director of the Children's Community-Based Services here at CoveCare Center. I've been employed here at the agency for over 9 years, and I've worked in various programs, all under Children's Community-Based Services. So the purpose of the department and the different services in our department is we serve any child or adolescent under the age of 21 that is struggling with a social, emotional, behavioral health, or a substance use challenge. They don't have to necessarily be already diagnosed. And for most of our services, it's pretty easy to get connected. Some services do have an insurance eligibility, and the panelists here today can go into more details about which services have the specific eligibility, but we do have services that is free, no cost to families, despite the social economic status, and is open to any family that is just looking to gain some extra knowledge, support, or connection to the community. So the services in the Children's Community-Based Services, I oversee 4 different services, and they kind of break off into little mini services. So I want to try to make this as simple as possible. Our one service that actually kind of oversees all of our other services is the Coordinated Children's Services Initiative, or CCSI. And that is typically the first way for a child to get connected to programs in the community. We work in collaboration with the Putnam County Department of Mental Health and other agencies within Putnam County. Sometimes it is it's the gateway to therapy for a child, it's the gateway for medication management, and it's the gateway to the other services we're going to talk about today. There is no, you just have to be under the age of 21. So in terms of eligibility requirement, it's pretty open. And parents or guardians just have to suspect there might be a mental health diagnosis. In order to get connected to CCSI, it's really just for any child that might be struggling. Could be struggling in their social world, maybe presented with some behavioral health challenges. So anyone can access that program. Other services I oversee is our Children, Family, Treatment, and Support Services. That is a Medicaid eligible program. So unfortunately, that is the one service where you do have to have a specific insurance in order to access that program. But within that program is 5 additional services. Families can access one service, can access all 5. It's really based on the family and child's needs. And as I already mentioned, the panelists can go into more details about what those services look like, but they range between therapy all the way down to family support and the whole spectrum in between. We have skill building, which Brandon will talk about today. Like I said, family support and youth peer support, which Wanda and Amanda will discuss. And then we also have our family peer support and advocacy program. You can access that program through CCSI. Families or caregivers can also just reach out to our advocates. And that is a program for any parent or guardian that is struggling with raising a child that has some sort of behavioral health challenge. Our advocates have their own lived experience of raising a child that had some sort of mental health diagnosis or a substance use challenge, and now they are here to be a support for other parents or caregivers that are in similar situations. We also have our Family Empowerment Program and our Supervised Visit Program. Family Empowerment Program, we work with families whose children are at risk of foster care. The only way to access that program is through the Department of Social Services. So that is actually a program that you, like I said, you have to be involved with our local DSS in order to access that service. But we do have our supervised visit program, and that is open to anybody who, for whatever reason, has to have supervised visits with their child, grandchild, niece, nephew. As long as there is a court order allowing those visits, then by all means you can come over to CoveCare Center and we could provide that service to you. That was a mouthful.
Super. Well, yeah, there's a lot of information for people to take in, and everyone should know that if they do have questions, there's a Q&A feature at the bottom of your screen through Zoom where you can ask us questions. Hopefully we'll get to answer them today while we're on the webinar. We will be happy to send a link to this recording out as well. And any questions that people have afterwards, of course, they can visit our website or call our front desk and be directed to the right person or department. So thank you for all that, Christina. I'd like to ask Brandon to introduce himself and talk a bit about what he does now. Morning, Brandon.
Yep. Good early afternoon to everyone. My name is Brandon Lillard. I am the Psychosocial Rehabilitationist Specialist, or PSR, and I've been with the agency for going on 3.5 years now. So my role with the PSR program, like Christina said, is to do a lot of the hands-on skill building exercise and activities with our young people and adolescents. Whatever the goal might be for that particular child and that family, my job is to come in and actually practice and teach them those hands-on skills so that they can then go and apply them out in the world. Just like Christina said earlier, in order to get access to the services, it is a Medicaid program. So you would have to get connected through either CCSI, or CCSI can connect you with the CFTSS program, and then you'd be connected with me. Doing this program, I've been actually in this role for just about a year now. So kind of came in with it new and learning as we go. So yeah, that's been my experience so far.
Super. Thanks, Brandon. Amanda, let's move on and hear from you on what you do for the agency and the community.
Hello, so my name is Amanda Boccardi. I have two different roles at CoveCare Center. So my first role is youth peer advocate, and that is through the CFTSS services as well. And then I also am the CCSI team coordinator. So as Christina mentioned, that's the Coordinated Children's Service Initiative. And that's basically just a partnership between families and service providers, which is designed to help families who have children with mental health needs. And it really just creates linkages to community-based services. So a little bit about CCSI. It is for children, as Christina said, up to the age of 21 in Putnam County who might have a suspected mental health diagnosis that impacts their functioning. So the access to the service is through a SPOA referral. SPOA is the single point of access. So anyone can fill out that referral. It can come through a school district, a service provider, even a family member. And in order to access it, you can contact me directly. I can give you the form and answer any questions you might have when filling it out. So what happens in this process is we receive the referral form and then we make contact with the family. Really just find out, what that family's needs might be, what their concerns are, and then we create a team for that family consisting of all different service providers that might be in the county. So it's really a collaboration. We set up something called a wraparound meeting, which includes all of the different providers we think might benefit that family, as well as the child and caregiver. And we all kind of just sit around a table, right now a Zoom table, but really just to, create a team and a plan to really best support that family. And what that family's needs are. We used a strength-based approach, so we discuss, what the child and family strengths might be, and we build off of that. So a little bit about the youth peer advocacy. As I said, it's a program CFTSS, so it's Medicaid eligible youth up to age 21, and that can be accessed through the referral form. So what it does is I provide, through a combination of training, I also have lived experience dealing with mental health, my own family members with the mental health system. And I basically just use, all of that training and experience to empower youth in whatever it is that they need. So whether it be navigating the system, developing self-advocacy skills, and it's really tailored to whatever the specific need of that child is, I'm there to support them in that.
Super. Thank you, Amanda. Let's move on to Wanda and hear a bit about what you offer to the community.
Hi, good afternoon, good morning, everyone. Thanks for having me, Eric. I appreciate it. My name is Wanda Crowley. I am a family peer support advocate. I have been with CoveCare 2 months shy of 5 years. So I work with families and caregivers that have children that are enrolled in Medicaid or non-Medicaid. I am a trained family peer support advocate. I have lived experience with my stepson. I've been advocating for him since he was 14, so I know the ins and outs of the system. I provide services to family raising a child or young child who's experiencing social, emotional, substance abuse, behavioral health challenges in their home, school, or placement. I facilitate wonderful programs at CoveCare. One of them is Family Connections. It's a support group that's currently on hold due to COVID. Usually we meet twice monthly. It's free, it's confidential. Parents share their experiences and they're validated. They know they're not alone. I also facilitate STEP, systematic training for effective parenting. It's an evidence-based program. It's 7 weeks, 2-hour sessions. It's for parenting skills training. The cost is $325, but if finances are a barrier, CoveCare can help with financial assistance.
All right, terrific. Thank you so much, Wanda. Now let's hear from Melissa LaChapelle in our prevention department. Good morning, or early afternoon, whatever we're saying.
Yes, hi everyone. My name is Melissa LaChapelle. I am the prevention supervisor. I've been with the agency for about 2 years now. What we do in prevention is provide evidence-based curriculums in the different schools in Putnam County. And in order to access these services, so the services are free. All the schools are able to provide them. And what we do, why we teach these services is to, I'm so sorry, I'm getting nervous, I don't know why.
Okay.
So why we teach these services is to prevent substance use within the schools and to promote healthy social and emotional learning skills. We also work with agencies within the community and provide public outreach. So within the schools, like I said, we provide evidence-based curriculums, and these curriculums are approved by the state. They've been around for years. We work in the elementary, middle, and high schools. So some of the topics we cover, so it's a series of lessons, and some of the topics we cover are bullying, empathy, problem solving, conflict resolution, drug resistance, vaping. And then in addition to the evidence-based curriculums we do in the schools, we also implement interventions depending on what the school needs are. So an example of an intervention we've done in the schools is vaping. So because the particular school had issues with vaping, we created a vaping curriculum for that school. Another intervention we've done, so we created something called Lunch Bunch. And because we found a school, some of the kids in the middle school, one of the schools we were at, were having trouble eating in the cafeteria. So we created a space for them to come and do small groups, eat with less children, discuss what's going on, do activities, play games, things like that. And then some of the work we do in the community, so we partner with different agencies. We partner with the coalitions, the Youth Bureau. We do a lot of work with Camp Hurlick and do outreach within the public.
Super, excellent. Thanks, Melissa. So clearly there's a lot going on at CoveCare Center. One of the things that I neglected to mention was who I am. My name is Eric Toth. I'm the CEO at CoveCare. I've been with the agency for just under 2 years. Started in the field about 20 years ago doing work pretty similar to what Brandon described in terms of working with kids who struggle with so-called serious emotional disturbance. So it's an area that I'm particularly passionate about. I also think it's worth mentioning that while what you've just been offered is a mouthful, there's a lot of acronyms, a lot of different kinds of services with a lot of different kinds of eligibility. It might seem very complicated to people who aren't familiar with it, but it's as easy as a phone call to touch base with one of the people in any one of these departments to learn more about it and to learn how you could be eligible for whatever element of service is important. CoveCare being the only not-for-profit provider in the county of this range of services means that we kind of have to be a little bit of everything to everybody, which is why you've heard we offer everything from prevention to social skills building to peer support for both children and their family caregivers or other caregivers, all the way to treatment and medication management in our mental health clinic. So it's really a wide range of services supported by the State Office of Substance Use as well as the State Office of Mental Health and the local county departments of DSS and mental health. So it's really a broad range, and that's part of the purpose, part of our mission, again, as the only not-for-profit provider in the county of this range of services. So obviously we're operating with these services. We've been offering these services for quite some time, but the context is a little different these days. As we all know, we've been involved in a pandemic for the first time in 100 years. And we've been dealing with this for the last 6 months, and it's impacted some of the ways that we deliver services as well as change some of the needs of the people who we serve. So I want to kind of pose this question to the panel. How has COVID-19, this current situation, change your services and change the needs of the clients who you serve? I suppose we could go in the same order. Christina, do you want to talk a little bit about that?
Sure. So as I reflect back on these past 6, actually almost 7 months now, since we're at the end of October, it has certainly been a whirlwind. It has come with a lot of adjustments, flexibilities. And when I think of how we've been able to meet the needs of our clients, to be perfectly honest, despite all the challenges, I do feel COVID has presented a lot of benefits. We've been able to be much more flexible in terms of billing. Some of our programs have very strict billing requirements that wouldn't allow us to spend a half hour on the phone with a parent that may be in crisis and be able to bill for that time. Our staff would still do it, but it would be unbilled time. Due to COVID, restrictions had been lifted, and we have been able to bill for telehealth services, whether it's over the phone or through some other video conferencing app. So we've been able to actually meet our clients a little bit better where they're at, especially, for our mental health clinic. A lot of times people do struggle with coming to treatment. That's part of their mental health diagnosis. So COVID actually gave that flexibility to allow the clinicians to do treatment over the phone. So clients have been able to access their treatment a little bit easier, rather than the struggle of having to leave their home and walk into an office and sit in a room with somebody. So overall, despite some of the challenges that we have faced, there has been a lot of flexibility and a lot of benefits in terms of meeting the needs of our clients and where they're at. The other panelists obviously will speak more details, but as a program director and just kind of looking over our productivity, I mean, our number of contacts with families have dramatically gone through the roof, I'd say. Outreach has soared to our families because we're not so focused on getting our 45-minute face-to-face session in. We're able to reach out to more people. And I would say be a little bit more productive than maybe having the stricter in-person rules. Not to say when COVID first happened, it was a challenge not being able to see our clients face-to-face. So that challenge in of itself was very difficult. And it was something that we, as a team had to work together and try to find ways to be creative. It was very difficult not being able to go to our clients' home or pick them up after school and do an activity with them and work, do some of that hands-on work with them. But luckily, the staff at CoveCare Center have been very flexible. And as, time went on and the warmer months came, I can speak specifically for my staff, they jumped on board with the opportunity to be able to see their clients face-to-face again. So we did open up some face-to-face visits, obviously maintaining social distancing and wearing the proper PPEs. So that in of itself has actually, now that we have face-to-face visits and the ability to also speak telehealth, I think we kind of have the best of both worlds right now. So despite the challenges, there have been some benefits. Eric, you're muted.
Sorry, my dog was barking again. I had to mute myself. Brandon, let's hear from you. How have things changed, in your work since the COVID-19 situation?
It's been an interesting change. I know for when this first started, when we were having our group meetings and things like that, we kind of kept talking about how the situation is going to kind of force everybody to adapt and to get adjusted to the way things were going about. So for the young people that I've been working with, I think it's been a good experience so far. I know at first, once we were able to start utilizing things like Zoom and, the video conferencing apps, those were really helpful. But for some of our kids, it was kind of difficult for them to really connect. Part of it because they were spending so much time, adjusting to being at school on Zoom and things like that. So, this pandemic kind of forced us to kind of improvise a lot, like Christina has said. For me, it was really helpful because I was able to get a little bit creative in how I was able to implement services. So I started meeting with kids using video game consoles. So kind of going into their world and bringing the service to them, meeting them where they're at. And I know especially those first months leading up to the end of the school year, meeting with kids that way was really helpful. It was really good, especially for kids who, there were kids who we had connections with prior to the pandemic, and then there were clients that we got after the pandemic hit. So trying to connect with those kids, not having that face-to-face, was kind of difficult at first. But once I was able to kind of, like I said, come into their world and implement things that they knew and they were comfortable with, we saw a lot of improvement, and we saw a lot of families really kind of, I feel like they were more connected with us than they were before. And I think for a lot of our families and a lot of our young people, this situation also kind of made them realize how important their mental health was. And it really, I've kind of seen a lot of kids kind of take some more initiative in making sure that they're getting their needs met. You know, I know a lot of us, when we were going in meeting with these families, we were talking about you need to have a structure, you need to have some sort of system in place in order to keep yourself functioning throughout all this chaos. And I know for a lot of our families it was helpful. And because we were able to really connect with them so easily, whether it just be through a phone call or a quick FaceTime, I think a lot of our families felt more supportive than they had before. So yeah, technology was really a big ally.
Yeah, that's great. Thank you, Brandon. Let's see, Amanda, can you talk to us a little bit about this topic?
Yeah, absolutely. So, you know, I also am doing telehealth and in person as well. What I will say, I definitely agree with Christina. It's created a lot more flexibility. It's allowed for more available, just the kids, you know, not being on such a tight school schedules, you know, going to school all day, coming home, having homework. It's definitely opened up flexibility in that area to be able to meet with kids at different times during the day. So that's been really great. What I will say, you know, in regard to the schools, I mean, the schools are doing a fantastic job. They're absolutely doing the best that they can. You know, being able to still provide that learning environment for kids, kind of meet the needs of the kids, but also to keep everybody safe. In that, I think the unknown and the uncertainty for kids has created a lot of stress and anxiety. Just not knowing what's going to happen day to day with schools closing, reopening. You know, and that's to nobody's fault. It's just, you know, the culture of what we're doing right now. So, you know, I think that that's been a big concern for kids and families. And it's been a lot of the work that I'm doing with the kids, is really just, you know, trying to combat that stress and anxiety with, you know, what are some parts of your life that you can take control over. And, you know, that also relates back to, you know, learning those self-advocacy skills, you know, navigating the systems, whatever aspects of their lives that they are able to kind of grasp and take control over. Just to give them some sense of stability. What I also will say is I think because COVID is something that we're all experiencing, regardless of socioeconomic status, disability, whatever, whoever you are, wherever you are, it's something that just, you know, as a community, we're experiencing as a whole. So I think that that's actually created a lot of connectedness, and maybe helped to build rapport even with us and families, just because, you know, it comes from a, you know, we're all going through this, we're together in this, we really understand. So I think that aspect of it has definitely been beneficial in really just creating relationships with families, and being able to support them.
There's something to be said for us all being in this together at this point, right? All right, Wanda, can you talk to us a little bit about how COVID has changed things?
So, as you know, I work with a population of families and caregivers. As Christina said, we have less face-to-face visits. I'm getting more telephone calls from parents because they're making more time for themselves. I'm having more telehealth visits. As Christina said, the billing for telehealth is more available. So some of the changes for parents and caregivers, they're experiencing childcare difficulties, financial difficulties, job layoffs. They're experiencing emotional stress and anxiety. Parents are stressed and overwhelmed through the remote learning. They're tired of being on Zoom all day. They're tired of getting their electronics. They're tired of trying to get online. They're getting more phone calls from schools, some experiencing difficulties with their children engaging with remote learning. So I'll get a lot of phone calls. What can I do to help my child? I've been connecting parents to more community services, local food pantries, community action program. I've been helping families with applying for unemployment benefits. So it's been a tremendous impact. And I commend the families for doing what they're doing. It's amazing.
Thank you, Wanda.
You're welcome.
Melissa, how have things been in prevention?
So, as everyone knows, the schools kind of abruptly shut down mid-March, early on in the pandemic. So we were about a little more than halfway through the lessons we were teaching, and we really did want to finish them. So we did create virtual lessons to complete the lesson, to complete the curriculum. And this was something we've never done before. So it was kind of hard, but we did work with other prevention teams in the state. We attended webinars and trainings and kind of figured it out. Some of the things we did, so for the elementary school, there's puppets they use to teach the lessons. So we did pre-recorded videos of ourselves doing the lesson with the puppet. We did PowerPoints with activities and videos. Then towards the end, we were able to do live Zoom classes, which I think are the most effective. And then this year, it's been very different for us. We're teaching more so virtually, the live Zoom classes. We are in person in one school, and something we did differently, which we thought would be great for the students. So rather than kind of like jumping right into our curriculum, we started off with small groups. And within the small groups, we talked about, you know, how did COVID affect the end of your school year? How did it affect your summer? How was being quarantined, doing online learning? How's it being back? Fears, concerns you have. And we try to do it in the virtual classes as well, but it's a little harder. So yeah, it's been very different, but it's been going well. I mean, we're just happy we're able to still provide our prevention services in the schools, even though they have so much going on trying to do the online learning, and they've been so welcoming to have us back, which is great.
Super. Thank you, Melissa. So it really sounds like we've been able to find new, flexible, and different ways of providing what we've always provided to people. There's been regulatory flexibility that's allowed us to do those things. And for those of you who are participating who are concerned about how agencies like CoveCare are staying afloat, some of those regulatory flexibilities have helped us quite a bit. Of course, the support of the community is essential. And in addition to doing what we've kind of always done, but doing it differently, we're seeing some different types of needs, right? It's good to hear that there's a heightened awareness of the need to focus on mental health for people. Obviously, CoveCare stance has always been that we always need to have a heightened need and to lower the stigma around, acknowledging that these challenges exist. But if there's a heightened awareness that the need to focus on these is central, then that's good to hear. And of course, some of those basic needs, like Wanda pointed out, housing security, economic security, food security, all those things just add to the uncertainty. I can't remember exactly, it might have been Amanda who spoke to kind of just this uncertainty that all the people who we support have need for, as well as all of us, because we're all in a similar situation where there's just a lot of uncertainty about what the future is going to bring. Just quickly, we did have a question pop through from someone who's just, wants to know what to do if they're concerned about their child, but they're not really sure if anything's wrong, like what can CoveCare do? I can answer this question. You should give us a call. You're welcome to call the front desk, get through to whoever is handling the phones that day, and ask to be connected through to Christina would be a great place to start. She can talk to you, discuss what's going on, figure out where our supports at CoveCare would make the most sense, and take it from there. Without knowing the specifics of the situation, I can't really answer exactly what we can do, but we can do something, and we can make sure that your child and you get connected to the right supports to keep things positive for you. So thank you for the question. So we're talking a lot about need, and we're talking a lot about services, and I know it's a mouthful. It's a lot to take in. A little easy for us, obviously. Between the 6 people on this panel, there's dozens of years of experience in this field, so we get this and we understand it. But let's talk a little bit about successes, right? I'd love to hear from our panelists, example of a success, whether it's to do with this time period of COVID or just a more general example. And I'd just invite someone I don't need to go in an order particularly, I'd invite someone to start talking about that.
I'll jump in first. I know we're not going in the same order, but
yeah,
it's awkward. Yeah. So as I was thinking about different, the success stories, a lot of the success stories I hear are my staff sharing them with me. So I wanted to kind of take a step back and think of, the successes that I've experienced with my staff and for my program. And honestly, as there's tons of stories, but, in relation just to COVID, a huge, huge success has been the staff's ability to be so flexible. They really, we literally went into work on March 16th and we got an email basically telling us, find out the equipment your staff needs and tell them they're going to start working remotely once they have all their equipment. And by the following week, we were all working remotely. So that was a huge change from being in the office 9 to 5, 10 to 6, whatever the hours were, running into the field all day long to see our staff, running to different school meetings. It was a huge change in a matter of, between 1 to 4 days. So when I think of a success, I just think of the staff and their ability to adapt to that change in order to meet the needs of their clients. They weren't doing it for themselves. They weren't doing, despite if they wanted to fight the new rules or not, they were still going to get a paycheck at the end of the week. They were doing this for their clients because they knew that their clients, if they were experiencing hardship or if they were experiencing anxieties around all these changes, then their clients were definitely going to be experiencing the similar feelings. So they really stepped up and totally got on board with any new rule we kind of had to put in place, a new protocol to follow. And things were changing by the day. I would tell my staff one thing one morning, and by the next morning, something new would pop up and the agency would have to implement a new policy. And my staff totally and all the entire agency's employees, I keep referencing my staff, but everyone really they did what they had to do and they did it for their families. And as a result, I would do periodic outreach calls to the families just to make sure, how's it going? Are your needs being met? Are you hearing from your workers? What do you need? What can we do to support you? And literally every family I spoke to said, we're good. I just spoke to Brandon. We're good. I just had Wanda on the phone. So-and-so just connected me to a service. I didn't have one family that said, oh my God, please help me. Which really goes to show how the staff really, they put their families first, they put their clients first. And the takeaway, I think, from all of COVID is we can adapt, we can change despite the anxieties we may all be feeling. But I really do felt that our families were served during this time and are continuing to be served. But that, to me, as a director of a program, I was extremely proud and just over the moon, thrilled with just how our families were taken care of so well during this time.
Well said. Thank you, Christina.
Thank you.
Who else would like to share a success?
I'll share. So we, myself and some of the other CFTSS members, I think, we had a couple families who we had some difficulties with prior to COVID, with just really getting the family to really kind of just follow through with the suggestions that were being offered, things like that. And I was really surprised on how much those same families were, like I said, once this pandemic took over, they were a lot more open to the suggestions that were being offered. And I felt like communications was increased significantly. We had a lot of these families who we were talking to almost on a daily basis, just helping them get through, this new dynamic of, being stuck at home with your loved ones and things like that. And for some of these families, we found out how important school really was and what it offered for these families and what it provided. So not having that space anymore, a lot of these families struggled with, getting their needs met because they really had no time away from each other. So getting a lot of these families to be able to implement structure and then to follow through on it has been some of I think the best things that I've seen so far. And even to this day, I was just telling Christina about one family in particular, just how night and day the improvements have been from 7 months ago to today. And, I do think part of it is because of what we've all been going through, but they felt that they were able to rely on their team a little bit more. And I think as staff members, we were able to dig in a little bit more and kind of provide services in a different way, and I think in a more effective way. So it's been awesome to see thus far.
Super. It's so nice to hear about, people making progress and feeling, feeling good and feeling supported and doing things in a way that makes them, feel more fulfilled as a family, even during these challenging times. So that's nice to hear. Anyone else from our panel have?
It's Wanda. I'll share if that's okay.
Of course.
So I was introduced to my client when her son came to the CFTSS program. Her son was expelled from the local middle school. My client engages with the family support services. She attended Family Connections. She's currently attending the STEP classes. She's learned how to effectively communicate and advocate for her son. The son's now enrolled in an appropriate program at the local middle school, thanks to her advocacy and thanks to our support from CoveCare. The client now has engaged her son with a medication management provider at CoveCare Center. He's now taking the appropriate medication. He's so compliant with his meds now that I sometimes transport mom to CVS to pick up the meds, drive them to the middle school, and the nurse is able to give this child his daily dose. And now the son is engaging with peer interactions. So I feel that's a wonderful story to share. I wish I had this advocacy when I needed help with my stepson. So thank you for letting me share that.
No, it's a great story, and I really appreciate that. It sounds like, while of course, CoveCare and you in your role help provide some of that advocacy, you've also helped this mom advocate for herself, right, and advocate for her child. Not so that folks aren't just relying on us to do that for them, but we're helping give them those skills and build those skills up so they can sustain that for themselves. That's a really important point to make. So thank you for that.
You're welcome.
Amanda or Melissa, success story?
Yeah, I can go next. So actually speaking to, that topic of self-advocacy and also, working with a specific client, I'm going to share this story because I think it really speaks to the uniqueness and like the person-centeredness of the program. So this is a child that I worked with, in a group setting prior to working with her individually. So she's very, outgoing, big personality, great sense of humor. But that's all kind of on the surface. She's got a lot going on, in her home and her whole childhood, really, that really, I think, gets suppressed, especially, in the big group setting. So once I started working with her individually, I think it really created an environment for her that she was able to just really, delve into what's going on underneath and what her emotions are and, how it just affects her in the relationships in her life. So, in doing this, I think, it's consistent, it's more intensive, it's personalized. So what we've been working on is, helping her to communicate more effectively and also, that self-advocacy that we all keep talking about, just because it is so important, especially in young people. It's important to learn to articulate what you need and what you want. I think a lot of young people have a hard time really finding that voice. So I've really just been doing a lot of work with her to help her try and find that voice. And it's impacted a lot of the relationships in her life, just across the board, whether it be peers, family members. One relationship that I don't think she ever thought would be mended has been mended. So I think just kind of, helping her to just empower her in the areas that she specifically needs. And the program kind of gives me that flexibility to really just, like Christina saying, meet the client where they're at and support them in whatever it is that they need to be supported in. I've seen it impact lives in a really positive way. So I think that's really important.
Great. Yes, it is very important. Thank you, Amanda. Melissa, how about prevention?
Sure. So I thought, in honor of Red Ribbon Week, which is going on right now, I would discuss our recent Red Ribbon Week campaign. So quickly, Red Ribbon Week is the largest drug prevention campaign in the United States. It's been going on since the 80s. And so normally we'd be a lot heavily involved in the schools, setting up tables, hanging posters, talking to the kids as much as we can about it. But this year, with everything going on, we thought we'd do something a little differently. So we asked local businesses and public offices to help spread the word. So what we ask them to do is either shine a red light outside their business or put a sticker on their to-go bags with social norming quotes. So this was just to raise awareness and to get the community involved with the campaign and with Red Ribbon Week. And so we made calls, we sent emails, we went door to door, and we've gotten over 50 businesses to participate, which we were super happy with. Everyone was so accommodating and nice. And we've also had each town hang a banner, which we created, that says Putnam County shines a light on drug prevention. So I'm not sure if anyone's seen those or gotten a bag from the Carmel Diner or somewhere around the area with our sticker on it. But we were, like I said, we've never done something like this before. We'll definitely continue to do it every year. And we were super happy with the turnout and consider it a great success for us.
That's awesome. Thank you. And I'm sure a lot of people have seen that. I've gotten some pictures sent to me from different places with the banners and stuff. So that's super. Thank you, Melissa. We did have one question come through. So we're basically at the point where we could field some questions. If anyone has any more, they're welcome to throw them out in the question and answer. Christina, I'll probably ask you just to cover this one. It's probably relatively quick. What's the age of the children that we engage with, and what areas do we serve?
We, in the Children's Community-Based Services, we can engage with any child under the age of 21. So actually in our CFTSS program, we just took on a 3-year-old, which is new territory for us. But I think, again, my staff is very flexible. So they are, willing and eager to learn more and to serve that age group. So I would not go younger than 3, to be honest. I think that's kind of pushing it now. But yes, any age under the age of 21. And again, it's any child that could be struggling with some type of social or emotional behavioral health challenge, a substance use challenge, honestly, anything. And to go back to, I think there was another question about, I think my child might need some support. I just don't know. Just call and ask. I am more than happy to talk to anybody through, any experiences you may be having with your child. And if CoveCare is not the appropriate place for them, then I could also make referrals to a more appropriate placement. But we really, if a child is struggling with, social skills, making friends, maybe just handling their emotions and feelings, by all means, CoveCare, we can serve them.
And in terms of geographic range?
Sorry.
That's okay.
So yes, it's mostly Putnam County. However, we do have our care management department program here at the agency, and they do serve children and adolescents that are, in northern Westchester County, southern Dutchess. And we are looking to hopefully change our geographical area to also be able to serve northern Westchester and Dutchess, in our other services.
Okay, that's great. But even if someone lived just over the border, there's no reason why they couldn't call us. And if they're listening and they need information, we know our partners throughout the Hudson Valley, and we can make referrals to other agencies as well, of course. And of course, for our mental health clinic, while typically we would say if you can make it to our clinic and geographically easy enough to travel to, then you should call and have an intake. Right now we're all remote, so I would encourage people to call and find out how they can access services through the mental health clinic as well. Are these free services is the follow-up question. So I think the general answer is that it depends, right? Some of the services are, reimbursable by insurance. If children are Medicaid eligible, a variety of services. There are some ways for families who do not have Medicaid to access certain of these services for their child, depending on the level of need. But again, without getting into a specific person's individual situation, the best bet is just to call and talk through what you would be eligible for and how we can best support you to get the services that you need. The person's asking if you're not involved with Medicaid, how do we handle these services? So it depends on the specific service. Unless Christina has any other thing to jump in on, or anyone else has anything else to jump in on that. That's the answer there. Is there anything else to elaborate on that, Christina?
I will say, if you don't have Medicaid, so we split our services between Medicaid and non-Medicaid. So if you do not have Medicaid and you fall in the non-Medicaid category, through our CCSI program, we can still connect you to services and they will be free of cost. So we certainly, if we can't bill your Medicaid insurance and you have private insurance, we then do not bill any insurance. And the service provided would be free of cost.
We have another question saying that they saw someone looking for help on Facebook and asking about how long the wait was for different services. It really depends on what service area that person was looking for. In our mental health clinic, there is sometimes a wait for an intake, but what we're really working on is making sure that if people are waiting for our clinic service or clinic-based services, that we can offer them some other support in the meantime, and whether that's someone looking for services for their child, who can speak to Christina and any of the other people on the webinar here to find out what we can offer while they're waiting for those services in the mental health clinic. There is often a bit of a wait, and we're always looking to add new people to our team so that we can expand our services and lower the amount of time that people have to wait for those services. So it's a great question.
I'll jump in again and just say the services that we did talk about today within the children's community-based services, we do not have a wait. So if you are Medicaid eligible and you'd like to access any of the CFTS services, there are no wait lists. Same thing with CCSI. As soon as you get started with that program, connections happen very quickly.
Great. Excellent. So we did promise, if more questions pop up, of course, we'll answer them. We did promise to share with everyone the 10 ways to combat stress. I think we've all gotten a lot of advice on how to do this in the last few months, but the stress is never ending, and uncertainty leads people to that level of anxiety and stress. So I'm just going to quickly share some stuff that our team came up with here. These are some tips for managing stress, and we will, like I said, we'll include these with some of our post-webinar communication. Right? I think always advisable to get lots of exercise and eat healthy. Nourishing the body is one of the best ways to nourish the mind. Sleep and well-scheduled and consistent sleep is very important. Get your rest, take your breaks, get up from your desk. I will be getting up and walking around after we're done this webinar. I can tell you that much. Find some time alone, breathe, meditate, do things that you love. Don't forget, it's okay to treat yourself nicely, right? Read a book, do some gardening. Remember hobbies that you enjoy or that you haven't enjoyed for a while. Maybe you can go back to them. You have to be patient with yourself. Exercise self-care. Don't judge yourself and the way you're coping based on the way you see other people coping, right? And try not to judge other people based on the way you see that they're coping either. Avoiding negative coping skills such as drugs and alcohol is always an important element of self-care. And if that's something you're struggling with, CoveCare can be of support to you in that area. Taking some time for yourself. Celebrate. Take some. A lot of people are struggling, and we all are in different ways. But we gotta focus on the successes and the positive things. It changes the way you narrate what's been happening to you if you focus on the things that have gone well. Spirituality is a really important piece of wellness for people. If you pray, if you enjoy nature, if you meditate, in whatever way that you access your own spirituality is important to you, then focus on that. Take the time to do that. For a lot of people, having a plan, being scheduled, staying organized, not letting the stuff of your life creep in and cloud out your ability to stay calm and well is important. If being creative is important to you, then practice some art. Dance like you think no one's watching. Just do things that make you comfortable and exercise that half of your brain. Connect. This has been a big one. I've heard from more old friends and family members who I haven't spoken to much. I've found personally that I've taken for granted a lot of the great people that I have in my life, and now that I can't see them, I wonder why I hadn't been seeing them. And so connecting with other people or building new relationships where possible, super important right now. So those are just some. I went through that kind of quickly because everyone's had a lot to say, which is great. We will attach those pieces for you as we as we start talking about our follow-up to this webinar. First, I just really want to thank again the sponsors here. I want to thank them for their financial support, not just this year, but over time. It's super important. Just to echo what Christina was saying, in terms of her success, sort of really focusing on the staff. CoveCare opted to not do a virtual. Obviously, we weren't going to do an in-person fundraiser. We opted not to do a virtual fundraiser this year either. But when we considered doing it, what we wanted to do was really highlight and honor our staff. And this webinar series is a way of doing that, because without the hard work of the people who are on screen here with me today, and the 90 or so other people in the agency who have been doing everything from answering the phone, getting the bills out, to working with our clients and supporting them and their families, we wouldn't be here, and we wouldn't be continuing to provide such an important service to the community. So that to me is one of the main points of why we're doing this, to honor and respect the staff and the work that our team has been doing to support the community of Putnam. You will get a follow-up email from this. We may ask you some questions about whether this was useful. We will post a recording and make sure you have access to that, so people can remind themselves of the things we've talked about. And of course, this is in lieu of a fundraiser, but if there's people in the audience who feel like they can support CoveCare or encourage others to do so, that's going to become more important for us than ever as time goes forward, and then as the needs increase and our need to be flexible to meet those needs increases. So it shows a lot of other great positive things that we should look at and talk about. I know some people would have loved to hear about Brandon's podcast project today. I don't know that we have time to talk about it right now, but people should go on the website, listen to the podcast, read about it, and hear about what Brandon's been doing creative ways with some of the young people in his program. And I think we're hitting off. We're a couple minutes early here. If anyone has any more questions in the audience, I don't see anything popping up, or any other closing remarks from any of our team members here.
Thank you for joining and listening in. This has been thought this was a really nice opportunity for not only myself, but also for the staff to be able to highlight the great work that they've been doing. So thank you for this opportunity.
Yeah, it's really great. And I hope that people call us if they have questions about how to access the services. And if you're in a school district where CoveCare is not working to provide prevention services in the school district, but you are wondering why not, reach out to us. Reach out to Melissa, reach out to me, reach out to the agency, reach out to your school district and find out how come we're not there. It might be that we have not been invited to be a part of it, but we're open to expanding those services. We have the funding to do it. It'll come at no cost to your school district to have us there. And we really need to be getting that work out to the community as well. So, all right, with that, we can say goodbye. Have a lovely day. Stay dry if it's raining where you are. And take care. And thanks to all our attendees for being here today.
Thank
Bye-bye.
you.
Thank you.
Bye.
Bye.